Hello. Here at St. Rita's, we focus on patients' needs. Athletic trainers are unique healthcare professionals who specialize in prevention, diagnosis, treatment, and rehabilitation of injuries and illnesses. In most cases, athletic trainers are the first on the scene of an injury and are valuable assets to high schools and universities when determining proper procedures and how to handle athletic injuries. When it comes to spine boarding an injured athlete, an athletic trainer can provide proper care to the athlete before advanced medical professionals arrive. The athletic trainers at St. Rita's take spine boarding seriously. Just as other injuries, spine boarding has a certain protocol to follow. St. Rita's athletic trainers use this protocol when spine boarding athletes. This is only a St. Rita's procedure. Please check with your local emergency departments to review their protocol. Keep in mind, the athlete's safety is our #1 priority. In this video, we will show and demonstrate proper techniques used in spine boarding an injured athlete. You will learn how to properly roll a prone athlete, placement on the spine board either using a log roll maneuver or a 6-person lift, equipment removal that focuses on face mask, helmet and shoulder pads, and the jaw thrust maneuver. First, we must learn to roll an athlete from the prone position, face down, to the supine position, face up. Once supine, we will demonstrate how to remove a face mask. A supine athlete is easier to assess and control C-spine before advanced medical professionals arrive. Upon seeing an injured athlete on the ground, the athletic trainer will assess the situation and make sure the scene is safe. Once safe, the athletic trainer determines if there is a spinal injury. These are a few examples of when spine boarding is necessary. If you suspect a neck or spine injury with numbness and tingling in the extremities, cervical spine injury with a compromised airway, unconscious athlete, multiple fractures, or a compound fracture. After determining there is in fact a neck or spinal cord injury, the athletic trainer or rescuer will have one of the coaches call 911. The rescuer who responded first will take charge of the situation and be located at the head of the injured athlete. The rescuer at the head will ask the coaching staff or other personnel, also known as rescuers, for help with rolling the athlete. You will need additional rescuers' help to assist you. Before rolling the athlete from prone to supine and the shoulder pads are present, the arm, on the side to which the athlete will be rolled, must be placed alongside the athlete. Rescuer 1 must make sure to have proper hand placement when stabilizing the C-spine. A good rule of thumb is to start with the hands placed at where you want to roll the athlete and then move your hands accordingly to the head of the athlete. Have the rescuers kneel to the side of the injured athlete you will be rolling to. Have the rescuers cross hands and reach under the athlete to hold on to equipment or material on the opposite side. Rescuer 1 at the head will give the command, roll the athlete halfway. The command is, prepare to roll. 1, 2, 3, roll. Once halfway, the additional rescuers can adjust their hands to help cradle the athlete. Rescuer 1 at the head will give the command to lower. The command is, prepare to lower. 1, 2, 3, lower. By rolling the athlete onto his arm, the head, shoulders, and pelvis are kept in anatomical alignment. After the athlete is supine, the face mask needs to be removed. With Rescuer 1 at the head in charge, the other rescuers must work around Rescuer 1 maintaining C-spine with the tools to remove the face mask as quickly as possible, being careful not causing more damage to the athlete. When removing the face mask, first start at the side clips. We will demonstrate how to remove the clips using different tools. First, using a gardening pruner. Make sure to remove all plastic that is holding the face mask. Now, on the other side clip of the helmet, we will be showing the use of an electric screwdriver. Again, you want to make sure the plastic clip is completely off of the helmet shell. Rescuer 1 continues to maintain C-spine to help minimize any head movement. After both side clips have been removed, the face mask can be flipped to the top of the helmet to allow better access to the top 2 clips, and you can remove them by using a trainer's angel and a handheld screwdriver. Any of these tools can be used on all 4 clips of the helmet. By using these different tools, the purpose was for demonstration only. Once all 4 clips have been detached, the face mask should be removed from the helmet, making sure not to move the head. Once the advanced medical professionals arrive with the spine board, have them place the spine board opposite the rescuers. The rescuer at the head still has C-spine and is still in command instructing other rescuers. Have rescuer 2 and 3 reach across the athlete and grab the clothing underneath the athlete to prepare for the roll. Make sure to keep the arm in proper position. The arm must be to the side of the athlete before the roll. If no shoulder pads, keep the arm stretched over the head to assist in the log roll maneuver. Once in place, rescuer 2 will be positioned at the chest, while rescuer 3 will be at thigh level to control the hips and legs during the roll. Rescuer 1 will explain that we are going to roll the athlete to a 30-degree angle, and rescuer 4 will then place the spine board under the athlete and against the athlete's back at a 30-degree angle. Once in place, rescuer 1 gives the command, "Prepare to roll. 1, 2, 3, roll." Once the athlete has been rolled to 30 degrees and the spine board in place, rescuer 1 will then give the command, "Prepare to lower. 1, 2, 3, lower." Once on the spine board, the athlete's position may not be ideal for securing them. For repositioning the athlete, have rescuers 2 and 3 straddle the athlete and slide them at an angle depending on the athlete's position. Rescuer 1 explains that we will be sliding towards the head and then towards the feet in a zigzag angular movement, but only sliding the athlete on the spine board. Once in place, rescuer 1 gives the command, "Prepare to slide towards the head. 1, 2, 3, slide." The movement should be at an angle, then rescuer 1 gives the command, "Prepare to slide towards the feet. 1, 2, 3, slide." Now, properly positioned on the spine board, the rescuers should work together to secure the athlete, making sure to secure the torso and knees first before securing the chest. The athlete's arms should be left free from the strap to facilitate vital sign monitoring and IV access. Once the athlete has been buckled in, make sure any excess strap is tucked away. You will want to tighten the straps to prevent the athlete from moving on the spine board during transportation. When the athlete has been secured, the head should be secured last. Necessary padding should be applied under the athlete's head to fill any voids and maintain neutral inline position. Rescuer 2 and 3 must now work with rescuer 1 to place lateral restraint pads, or in this case rolled up towels or blankets on each side of the head. Once the towels are in place, rescuer 1 still maintains head position. Rescuer 2 and 3 can then use adhesive tape to tape over the forehead and chin to secure the athlete's head to the board. Once secured to the spine board, the athlete can be lifted and transported on an ambulance gurney and placed into an ambulance for transportation to the nearest hospital. The second technique that we will be showing you is the 6-person lift. Rescuer 1 is at the head maintaining C-spine stabilization. 6 other rescuers will position themselves along the athlete's side, 1 at each side of the chest, pelvis, and legs. Another rescuer will be in charge of the spine board, which is placed at the feet of the injured athlete. Have rescuers kneel down on one knee to avoid back straining and place the hands under the equipment with hands crossed to provide a firm, coordinated lift. Once in place, rescuer 1 will give the verbal command, "Prepare to lift 6 inches off the ground. 1, 2, 3, lift." After the athlete has been lifted, rescuer 1 gives the verbal command to slide the board towards the head, and they will also give the command to stop once rescuer 1 feels the spine board is properly positioned. Rescuer 1 will then give the command, "Prepare to lower. 1, 2, 3, lower." Once on the spine board, the athlete's position may not be ideal for securing them. For repositioning the athlete, you may be able to slide the athlete using the techniques as mentioned previously. After proper position of the athlete on the spine board, secure the athlete as shown before. Next, we will demonstrate the removal of equipment that focuses on the helmet and shoulder pads. These are a few examples of when to remove the helmet-shoulder pad complex. If after 1 minute and the face mask cannot be removed to gain access to the airway, if the design of the helmet and chin strap is such that even after removal of the face mask, the airway cannot be controlled or ventilation provided, if the helmet and chin straps do not hold the head securely such that immobilization of the helmet does not also immobilize the head, if the helmet prevents immobilization for transport in an unsafe position, if the helmet is removed, The helmet-shoulder pad complex should be thought of as an all-or-none scenario with regard to spinal mobilization, if multiple injuries require full access to the shoulder area. And lastly, ill-fitting shoulder pads cause the inability to maintain spinal mobilization. When the medical staff determines that the helmet needs to be removed, the shoulder pads must be removed at the same time. You will now see how to properly remove the helmet and shoulder pads on an injured football player. Rescuer 1 will continue to maintain C-spine at the head, while Rescuer 2 and 3 will be kneeling by the head of the injured athlete and cutting the chin strap and jersey off the athlete. After the chin strap has been cut the jersey from the neck to the waist and midline to the end of each arm at the sleeve. Once the jersey has been removed, cut the straps that secure the shoulder pads to the body and the laces or straps over the sternum. After all clothing has been cut or removed, Rescuer 2 or 3 will need to remove any of the internal helmet padding. The cheek pads can be removed by inserting a tongue depressor between the snaps and the helmet shell. You will also need to deflate the air out of the helmet by inserting a needle into the air bladder. Rescuer 2 will straddle the athlete face to face, with forearms on the chest, manually stabilizing the chin and the back of the neck with the ring fingers over the mastoids and the fifth fingers under the occiput, making sure to maintain the athlete's position. With other rescuers in position at each side of the athlete, their hands are directly against the mid-back region. Rescuer 1 will give the command to raise the athlete to remove the equipment. 1, 2, 3, raise. After the athlete has been raised, Rescuer 2 now maintains the C-spine stabilization, while Rescuer 1 slides the helmet forward and backwards with slight rotation to help remove the helmet. Once the helmet has been removed, then immediately remove the shoulder pads by grasping the back of the shoulder pads and pulling the pads straight back towards Rescuer 1 until the shoulder pads are completely free from the athlete. At this time, all shirts, jerseys, neck rolls, etc. should be removed. The athlete is now lowered with the verbal command, prepare to lower. 1, 2, 3, lower. Once the athlete is lowered back to the ground, Rescuer 1 will take over at the head again. The athlete is now free of equipment and can be placed on a spine board, secured and transported to the nearest hospital. If any time the airway has been threatened, the use of a jaw thrust maneuver may be needed to open the airway of an injured athlete. The jaw thrust maneuver is an effective airway technique, especially with an athlete in which a cervical spine injury is suspected. This is performed by Rescuer 1 using their fingers to physically push the jaw upwards. When the jaw is moved forward, it pulls the tongue forward and prevents it from blocking the entrance to the trachea, helping to ensure the athlete a secure airway. On behalf of the athletic training staff here at St. Rita's, we want to thank you for viewing our short film on spine boarding the injured athlete. If you have any questions with spine boarding, please talk with your athletic trainer located at your high school or university.